Hi, I'm Debra Prosnitz. The purpose of my leadership project is to collaborate with diverse leaders to reimagine and develop new ideas for how to approach gender integration in public health work. Gender is a tricky topic to work on in any setting. Political and legal landscapes put restrictions on language to use and populations to address. Understandings of the definition and scope of gender work varies, and there's too often an assumption that having programs or policies targeted at women's and girls' health means that gender's been addressed. I've found that the structures that guide much of my work, such as funding or reporting mandates, create challenges in getting buy-in, understanding, and traction for the importance of identifying and addressing gender issues in public health work in different contexts. There's an inherent tension in gender work and ensuring that the work is country-led and that existing inequalities are recognized and addressed. I believe that successful and sustainable ways to integrate gender perspectives into public health programming and policy requires reframing gender to ways that resonate with local realities, shifts the definition of problems and decision-making power to communities, and supports the generation of an intrinsic desire by public health institutions and communities to integrate gender into their work. This is ultimately what's going to make programs and policies better designed for all different groups of people, particularly all genders, and consequently more effective and sustainable. For my leadership project, I wanted to bring together a group of gender experts across countries and diverse backgrounds to collaboratively rethink and reframe how to approach gender issues in global health. This grew into forming a coalition. As a white Western feminist, my leadership role is necessarily one that facilitates collaborative design and collective discussion. I'm finding myself learning different aspects needed for starting something new, leaning into my influencer style, and leading by keeping myself grounded in the core vision, but being open to new ways of achieving it. I drew on my networks, including WomenLift Health, to put together a steering committee. We are co-designing the coalition launch and have agreed on the coalition's vision, the roles and tenure of the steering committee, and we're currently finalizing milestones for our work in 2025. We hope to launch the coalition soon after liftoff by inviting members, a process that we anticipate being a bit of a snowball effort. As we move forward to determine what topics to tackle and actions to take, my hope is that the coalition's work will center local realities and aim to generate that intrinsic desire by countries and communities to integrate gender into their work. Questions that the coalition will aim to address include, how do we do this without embedding requirements from donors and concepts from Western feminists? How do we challenge colonial ideas of family and how that impacts approaches to gender integration in public health? And how do we honor gender identity definitions and categories that may be most prevalent in Western cultures vis-a-vis more localized identities and political challenges? But perhaps the most impactful part of my journey with WomenLift Health has been the connections that I've made with my cohort and the WomenLift Health team. What an astounding group of thoughtful, inspiring, and supportive women. During this journey, I've grown as a leader in the professional realm and within my family as I welcome my second child. The journey and engagement with my cohort has kept me grounded, connected, and motivated within my global health work, and it continues to support me as I navigate this ongoing transition of juggling parenthood and a global health career. I'm so thankful to be in this community. Thank you.